Good afternoon and welcome back to chapter 7. Gonna start on part 2, which was the landmarks of the oral cavity. And on this one, we're gonna talk about the vestibule fornix, the labial mucosa, buccal mucosa, parotid papilla, Stinson's duct, the linea alba, Fordyce's spots, alveolar mucosa, gingiva, and the labial frenum, and the buccal frenum. We'll go ahead and start with the oral vestibule. So essentially that's just kind of like, I'm going to call it the curvature, but it's like the dip in between. So like you have the gingiva that's like here, if you point in the oral cavity. And then you have the actual, like, say, labial or cheek. And so at the very deep crevice, that's going to be technically that little space that's in between those. That's the vestibule. And then the vestibule fornix is just the deepest portion of the vestibule itself. So you might have a section, like, say you have your labial frenum here. And then you begin here in this little pocket between the labial and the buccal frenum. And that's going to be the vestibule itself, but then the deepest portion of that is the fornix. So wherever that might be in the person's mouth, that could be located right before or right after the buccal frenum, I would assume. Naturally, probably around the canine, because it's going to have the longest root. I would assume that that would be kind of the deepest portion of the vestibule. And then next we have labial and buccal mucosa. So labial and buccal mucosa are simply like the actual cheek and lip tissue. So like that right there and this right here. So it's just that soft tissue that's on the inside of the lip and cheek. Then you have the parotid papilla. Papilla naturally are just kind of finger-like protrusions that come out of soft tissue, such as the small intestine, or large intestine. Those contain villi. So those are kind of like papilla, or like the papilla on your tongue. Little tiny little projections. And then I would assume that if you feel in the cheek of your mouth, toward the rear, you have a few little bumps. Sometimes you can feel them, sometimes you can't. Those are going to be the parotid papilla. They kind of are near the parotid, I would assume, duct. Actually, it might not be the parotid duct. It might be, maybe it's Stinson's duct. I might be wrong. Let me check. There's a thing on here somewhere. Yeah, the opening of Stinson's duct is located there. Near that also, you will find the linea alba, which is just kind of like a little white line that you'll find along the inside of a cheek. I don't know if you can see mine. It's not really detectable. Some folks, it's more defined than others. I know that if I'm a little bit more dehydrated, it's easier to see. But I've been super hydrated today, so you can't quite see it as well. But it's not going to be raised or bumpy. It's just like a little white line. You can kind of see. The book gives you a pretty good description. Sorry for the twitch. And then next is Fordyce's spots. You could probably Google this, because it's not going to be like, it's like yellowish spots, but it's not going to be like super yellow. Some people have them, some people don't, kind of thing. And sometimes they just kind of come with age, or probably more likely to occur with certain things. I would assume like smokers or those who chew tobacco kind of develop yellowish coloring in their mouth. Not to say that it causes Fordyce's spots. It could be anything, but that's just kind of the idea behind it. Then you have alveolar mucosa. So alveolar mucosa is just going to be superior to alveolar bone. And alveolar bone is just what holds your teeth in place. So all this right here, alveolar mucosa. And the alveolar bone is just deep to the alveolar mucosa. Everything's just holding your teeth in place. Then we have the gingiva. that's the gums. That's just the gums as a whole. Labial frenum, which is, we talked about, that's just the little frenum that sits right up under your lip, kind of in between your central incisors. And then the buccal frenum, I don't know if I can really get that back there that deep to show you, but it's just what holds your cheek to your alveolar mucosa or gingiva area there. So like there's just a little strip of tissue that sits in between. And between that and the labial frenum, those kind of form the vestibule of the mouth. And then we talked about that. Yeah, it says for Fordyce spots, it becomes larger and more visible with age. So next, we're going to talk about the palate area of the oral cavity. So I would assume, well, let's just kind of read it together, I suppose. On the inside of the maxillary teeth is a palate or roof of mouth. Okay, so the roof of the mouth. When you study the bone structure of this, very little is going to be actually the palatine bone. Most of it's going to be the palatine process of the maxilla bone. So let me see if I have a card that's going to show that a little bit better, because I don't want you guys to get confused down the road and be like, well, what the heck is this? You said it was just the palatine bone. It's a little bit more complex than that because of the way that the skull fuses together when you're in utero. So there's some sutures kind of involved in there, but I don't think you're going to need to know the sutures. Miss Estabrook will tell us accordingly. So this was a pretty good image. I'm going to rotate my camera really quick. Okay, I guess it won't let me. So we'll do this. Show it really, really well. And you're going to notice R, A, and Q. And I can show you this in person. So R, A, and Q. Now R, or A, is the palatine process of the maxilla. So why can't I rotate this? That frustrates me. So I'm going to try to show you, make sure you see what I see. You'll notice the little sutures that go down the middle and across here. So this portion is still the maxilla. It's just the palate process of the maxilla. And then here for Q, you have the actual palatine bone. And what if they don't fuse together correctly while in utero, you get cleft palate or cleft lip in some cases. Then R was the incisive fossa. So we talked about the incisive papilla the other day in class, and that's just the little raised bump that's going to be right behind the central incisors. I can't really show you one because I don't really have one. But I could show you this picture, sort of. Hopefully. There we are. And so you can see the incisive papilla, and that and the incisive fossa, which is just kind of another word for another dip. It's just a different type of dip. That is deep to the incisive papilla. So one's probably going to be really, really close, if not directly superior or inferior to the other. Let's see. And then there's going to be soft palate toward the far back of your mouth. And that just kind of begins the opening to the throat. It's what helps you kind of swallow. You'll have some muscles associated with there that we'll talk about later. Yeah, typically that far back of the throat, it's going to be darker pink or yellow as well. And on the palate, you're going to have palatine rugae and palatine raphe. So palatine rugae, like if you feel the right behind your incisors, like this, you can kind of feel some ridges or bumps. And sometimes when you get sick, it might feel almost scaly because everything gets super inflamed and it's super uncomfortable and gets super irritated. Those are going to be your palatine rugae. If you've ever studied anatomy and physiology, the stomach has rugae. So basically it's just kind of like wrinkles or folds. That's kind of all those are. Typically rugae in the mouth, those are going to go horizontally across the palate or the maxillary, or the palatine process of the maxillary bone. It's going to kind of go across horizontally. And then the palatine raphe, sometimes this is also kind of rough feeling, but not always. But it's going to go down vertically, the middle of the mouth. So like it kind of goes back that way. And then to the back of the mouth. I think that similarly to the incisive papilla, they kind of help you detect hot and cold. In some cases, people or doctors will tell you that it also assists with tasting. And so they tell patients who get dentures that sometimes their taste might be altered. Mine sort of was, but not really. I didn't notice much of a difference. So maybe I just don't have as many taste receptors, or maybe mine just don't work as well. Sometimes also, it should be known that the roof of the mouth might have a somewhat bony protrusion coming out of it, and that's going to be a dental tori or a maxillary tori, as you might hear it called more frequently. I actually have one. It's just naturally there. It has to be genetic because most of my family has that, and I know I've had mine my whole life. I never knew what it was until I literally started these classes. So, learn something new every day. And then you can also get mandibular tori, which I also have, but those typically more or less come from a lot of grinding or clenching the teeth, which I do a lot, especially now this semester's tests have been super stressful. But yes, it might just be bony protrusions that occur like lingually behind the teeth in the mandibular area. Those can actually, if they get big enough, can actually affect the ability to take x-rays effectively. So a couple of weeks ago, I know myself and a couple of other students went to the hygiene clinic, and I didn't know that I had them because it's been some time since I've had x-rays. And they attempted to put the x-ray receptor in my mouth, but it's actually super uncomfortable now. So we had to actually make some adjustments in order to get my premolar periapicals because I have dental tori, so they have to make adjustments accordingly. So keep that in mind when you start going out to rotations, that or ask other assistants who are well practiced in it, just to kind of like, how would you make that adjustment to kind of get around that, because it can be very, very painful and super uncomfortable just because it's a bone, like it's a bony protrusion. So you can't really work around it, can't get rid of it unless they're super severe, because usually they just tell you to leave it alone, don't bother it. You also have the uvula, which is, if anybody has heard a particular song, I think that also won Grammy of the Year by Cardi B. It's the little dangly thing that swings in the back of your throat. The theory behind that one is sometimes, I guess, like it could have originally, like way back in the caveman days, kind of like wisdom teeth used to help come in when we needed extra wisdom teeth. The uvula may have helped with like the epiglottis and swallowing. It's just kind of the opening that keeps food from getting into your lungs. It might have been for that. It could be extra taste. Nobody really knows. It's kind of just chilling there. If it causes much enough of a problem, then they can handle it through surgery or something. Or if it's not there, sometimes it's just not there. It's just one of those weird little things like the appendix. Anterior tonsillar pillars and posterior tonsillar pillars, those are going to be in the front and behind your tonsils. It's just kind of extra skin, muscle, tissue, if you will, that just forms the throat, just so that way the throat and swallowing, everything works as it's supposed to as food is going down, or drink, or what have you. People who get strep throat a lot will have their tonsils removed. So you can either see a protrusion or feel a protrusion there, or there might be nothing there if they had them removed. So if someone's got it removed, maybe their gag reflex is a little less sensitive, or maybe they have a little less issue with bacteria being in their mouth, just because the tonsils are gone, not harboring any more bacteria. Okay. The space in the back of the oral cavity, as you go into the pharynx and further back into the throat, it kind of begins the esophagus, like it ends the throat, begins the esophagus, you're going to have the fauces. Those just kind of help food continue to go down. That's just pretty much it. It just kind of works like the esophagus. It starts to bring everything down the way it's supposed to go. And then you have the tongue. We're going to go next to the tongue. It's a significant region of the oral cavity, and it has a sulcus terminalis, which is going to be like the little dip that's in the middle of your tongue. So like if I stick out my tongue, that is my sulcus terminalis, and it's just a dip in the middle of the tongue. Then you have circumvallate papilla, filiform papilla, and fungiform papilla. Oh, and you have foliate papilla and a median sulcus on the dorsal or top surface of the tongue. Let's see if we can find this on a picture. Okay, so circumvallate papilla are like the super big, like if you stick your tongue out far enough, you can't really see them on me. They're just like super big bumps. You could probably easily more see them on yourself if you go into a mirror. They're the super big bumps at the very, very back of your tongue. They just help with taste. They're bigger, probably to hold food back there a little bit better as you're swallowing. But primarily their function is taste. Then you have folate papilla. If you think about what molars are used for, which is kind of like grinding and breaking down foliage, like green leafy vegetables, things like that. The folate papilla help with tasting those things, because typically that's where you would chew them and find them. And that's going to be toward the rear and the sides of the tongue. So the posterior sides. And then you have fungiform papilla, which are going to be toward the side, or on the sides as well, but toward the anterior of the folate papilla. Median sulcus. Okay, so the median sulcus and the sulcus terminalis are kind of the same thing. It's just that dip in the middle of the tongue. And then you have the foramen cecum. So the foramen cecum is a dip on the back of the tongue that basically begins the digestive system's process. It goes from there to the other rectum, or to the rectum. I remember that just because cecum is a part of the large intestine. So foramen cecum begins the process and the transport all the way to the large intestine. I suppose that's a way that you can remember it. May not be your way. It just works for me. So for the folate papilla, they can help taste sour and bitter. Then you have the fungiform papilla, which are on the sides and front, like the tip of the tongue. Those can help taste salty and sweet. Filiform also help with bitter, salty, and sweet. You have a table, what is it, figure 7-6, that kind of helps break down like whereabouts those papilla would be and what they help taste. On a day-to-day basis, I eat plenty. I don't know the difference. I just know I taste food and it tastes good. Going further into the tongue and the floor of the mouth, making sure I don't forget anything. Okay, then you have the lingual frenum. So if you lift your tongue up, that is the lingual frenum. It looks like I have a couple of extra looking frenum, or that could be sublingual folds, just kind of keeping the tongue in place where it's supposed to be. Then you have sublingual carbuncles, kind of on either side of the frenum. It's kind of hard to see. Just kind of chilling there, along with some, well, obviously you can see my lingual veins. Those are blue. It's very easy to see. I have very good veins all over, so that's not surprising to me. But you could probably see those along with like sublingual gland and submandibular gland access ports, if you where saliva is going to come out. Sometimes if a person's got their tongue up and if you press on it, or if they speak a certain way or sing a certain way, you'll have what's called a gleet. And that's where basically saliva just like shoots out of the duct. Not always a comfortable or ideal situation, but it happens. Especially when you've got a patient's mouth open and you're playing around in there trying to figure out what's going on. This kind of leads directly going into salivary glands. Let's see. You do have a sublingual sulcus. That's going to be kind of like around, like if you've ever looked at the typodonts without the tongue for a mandible, you see that little dip that goes around like right behind the teeth. That's kind of the sublingual sulcus. It's just the dip, like that's like really right there behind the teeth without the tongue being in the way. And you could probably feel it with the tip of your tongue if your tongue had been that way, or you could feel it with your finger. I did not realize I've been already going for 20 minutes. I think I'll pause there, and then I'll start up another one starting with the salivary glands, and we'll cut it up there for now.